Joining us is Donn Farr, a Lancaster County man who unexpectedly became a patient at Penn Health Lancaster Medical Center. Thanks for being with us.
Thank you.
Why don't you describe your situation? What happened?
The night before we had a heavy windstorm. So I was out in the yard just picking up sticks, cleaning up. Got done, went into the house, sat down on the couch, and suddenly I got extremely hot, sweating profusely, and I couldn't cool down. So then I yelled for my wife because it was getting serious.
And so what did you do? Call 911?
My wife called 911, and they showed up pretty fast.
And tell me about the ride to the hospital.
Well, that was the first time we knew I was having a heart attack. It was a complete surprise. I had none of the traditional symptoms of chest pain, arm pain, nausea, just extremely hot and sweaty. And the whole way to the hospital, they were communicating with the doctor in the ER. And I do remember the doctor saying, "Hurry up."
Wow. So when they said heart attack, I mean, what was going through your mind?
It was a complete surprise. I didn't have high blood pressure, high cholesterol. I was never on any kind of medications.
Wow. Talk to us about the next step. When you arrived at the hospital, what happened?
The ER staff met us, the ambulance, right at the door. They were on the ball, and they wheeled me back into the ER. And apparently I was pretty chatty at the time, trying to get them to bring my wife in, because she worked in the medical field for 40 some years. And at some point my heart stopped. And apparently it didn't work for like 9 minutes, that they were administering CPR, 3 electrical shocks, and fortunately they got the oxygen into me right away in the CPR, that I didn't suffer any kind of brain damage that I know of.
Wow, that's amazing. So what did the doctor say? What did they do to correct this?
They got me into the cath lab. That team was already there also. And they found I had one clogged artery, 100%. And they put in a stent. I only needed one stent. All the other arteries were fine.
We were talking earlier, this just happened April 1st, April Fool's Day, which is hard to believe. So you were there in the hospital for less than 3 days?
Yeah, I probably showed up at the hospital around 4:30, 5 o'clock on a Saturday evening, and I ate lunch at home on Tuesday.
Wow. Wow, you're doing terrific. And you've made some lifestyle changes.
Yes, we changed our diet around a little bit. Not so much red meat, not so much butter, and we're supposed to be on a Mediterranean diet of some sort, but we're not fans of fish, so it's a challenge.
How are you feeling today? You look great.
I feel great. It's like nothing happened, and I felt that way from the day they sent me home. It was like nothing happened. They found a problem and they fixed it.
Wow. Very fortunate.
Yes, I was.
Thank you so much, Donn, for sharing your story with us.
All right.
And so glad that you're doing so well.
Okay, thank you.
Earlier, I spoke with Donn's doctor, Patrick Fitzsimmons, interventional cardiologist at Penn Health Lancaster Medical Center. Dr. Fitzsimmons, thanks for being with us this morning.
Thank you. Thank you. Good to be here.
You were the doctor who was at Penn Health Lancaster Medical Center the day Donn was brought in. Talk to us about that day.
So it was a weekend, and I got called from EMS with an EKG that he had at home. He was brought to the emergency department. We had activated the cath lab. We brought him up here to our cardiac cath lab, where I'm sitting here, and we found the blockage and treated it with a stent. And then he did well.
Donn said he went home a few days later. How does it make you feel to know that he's doing so well?
Oh, it's so exciting, because we're able to essentially put people back into the same spot where they left. So still with his wife, still, living life and enjoying it.
Now, many people do have heart disease or some early warning signs. When should they go to the hospital for treatment?
So I always tell people the best thing to do is a change. So a lot of people think conceptually it's always chest pain, but it could be shortness of breath, it could be fatigue. There's a lot of different signs that it could be. So I always tell people, if there's a change in your symptoms or your status, it's probably a good thing to get seen.
Now, staying healthy after a heart attack or heart event is really important. Talk to us about what you recommend to patients.
Yeah, the most important thing after you leave is still adjusting your lifestyle. So lifestyle modification to include what your diet is, particularly a Mediterranean diet has been shown to lower cardiovascular risk, and then exercise. If we all walk 45 minutes a day, we will lower our risk for 25% of having a heart attack.
And that's what Donn said. He has changed his lifestyle.
Good, I'm glad.
Now, talk to me about the expansion. You're there in the cath lab and you have more cath labs available. How does it make a difference for patients?
So access to care is the most important thing. We now have 3 cath labs at Lancaster Medical Center, including a hybrid, so we can perform all cardiovascular procedures and bringing advanced technology to the local area.
Oh, that is wonderful. If you have one last piece of advice that you could give to our viewers about heart health and heart attack prevention, what would it be?
I would say follow the diet and exercise that we talked about. Get your cholesterol checked. See your primary care physician regularly to get your blood pressure checked. I think all of those things are important for cardiovascular health and prevention.
Okay, thank you so much, Dr. Fitzsimmons.
Thank you.